and I'm not in pain. I'm just shivering, shaking, and it's not cold. It's hot. So one of my colleagues tells me, I just go home. Maybe you need to rest. I go to my HOD and I'm like, Mr. Pastor, I look at my hands, look at my body. I am in a zone. I need to go home. So he says, I won't allow you to go alone. Let me send someone to drop you off. So in the process of them dropping me, I call my husband and I'm like, hey, I'm in a fit. I'm just shaking. I don't understand why. I mean, I'm looking funny, like I'm just shaking. Everything about me is shaking. And so-and-so is dropping me home. We didn't live far from church. So he tells me, no, don't go home. Don't go home and sleep. You might sleep and not wake up. Turn, ask, let me talk to him. So he tells him, turn the car, take her to Warwick because we're nearby. And then when you get there...
So that's the nearest hospital.
Yes, Nairobi Hospital, Warwick. And when you get there, call me and then let me talk to the doctor.
Hello and welcome back to Your Health Kenya, a platform where we get to discuss everything matters health, and particularly this series where we have been just discussing reproductive health issues that a lot of women face just silently, and just breaking down the complexities of the different conditions and challenges that we as women face. And today we continue with a wonderful story from a lady. I'm not sure whether it's wonderful, but yeah, a story of, let me just call her a courageous lady who has gone through a myriad of, different complexities, issues in regards to reproductive health. And we'll just be unpacking her story as she gets to tell us more about some of the challenges, diagnoses, and how she's living with some of the health conditions. Karibu sana, Watele. I will allow you to introduce yourself.
Watele here. That's a nickname.
Yes.
Let's be very clear.
Your actual names.
My actual names. Actually, I have 4 names. Today, I'm exposing myself.
Yeah. Just
ID names, Ruth, Sheila. Yeah.
Wow, I didn't know that one.
Today, surprise. Ruth Sheila Isigi Waki. Waki is my marital name, which is now official in my ID.
Oh, wow.
Yes, that is my name. Yeah. Excited to be here, and it is a wonderful story because I'm here.
Yes, the fact that you're here, it's definitely
that's amazing. Yeah.
So karibu sana.
Asante.
And man, I think I've sat down with you before on a different platform just to unpack bits and pieces of your story.
Yes.
But today I just wanted us to focus on some of the reproductive health challenges that you've gone through as a lady. And my first question is, when did it all begin? When did you first discover that something is off in your body? And if you don't mind, just take us through what the diagnosis process looked like.
Okay, so I was going through a very heavy, stressful time at the point of diagnosis and prognosis and, symptoms. But prior to that, I was living. I was okay. I was just being my normal self. Nothing really that would cause me to be like, okay, something is amiss. I was just living life.
Was this in your teenagehood? Was it in your young adult years? Was it in, after you got married?
So now, in retrospect, after a long, hard look at, life, where did all this start? We got to realize, my husband and I, that the 2 symptoms here and there began actually in high school. Yes.
But they went unmissed.
It wasn't anything you would say, wow, this is worth looking into. Probably also because, especially with reproductive health, pain is normal. We have
the
normalized
menstrual pain.
whether it's menstrual or headache
for a
or
woman. For a woman, it's like take it all in. It's part of being a woman.
Drink Panadol, you'll be okay. We don't know how to stop, pause, and ask, why am I having a headache?
Which is very crucial. I think one of the things that I've been advocating in the health, this channel is women need to be, you are your own greatest advocate.
Exactly.
So listen to your body. Ooh. Identify if something is off. I mean, you're literally your own greatest advocate.
Let me tell you.
So don't let it go by.
We can even end this podcast just where you have said, listen to your body. Period. That is the sermon for the day.
Yeah.
Because
learn to listen to your body.
Yeah. No one will listen to it for you. So for me, I think it began in high school, because then in high school I'd get a lot of dysmenorrhea. That is little period. Like I can go not short. 4 days, yes. Okay, I could be short, sometimes even 2 days.
Yeah.
But nothing is dropping. I can stay paddless. Nothing. The only way I will know I'm on my period is when I go to for my short call and I'm wiping myself, then there'll be blood on my tissue.
Wow.
But it's not dropping. I was the envy of my siblings because you're so lucky.
Yeah.
You don't even need to wear a pad. Oh my gosh, you're so lucky.
Yeah.
Least did we know. We were having issues and we did not know.
Wow.
That those are issues that needed to be looked into.
Yeah.
Another symptom I had was the chin hairs. 1, hair. 2, pluck it off. You're fine. No biggie.
Deal. Yeah.
That's a symptom. That's a symptom. But because, we have been trained to, that's nothing big. You move on. We didn't really look into it.
Yeah.
By then I wasn't having painful period. Okay. It wasn't.
So it was coming off kind of like spotting.
Yeah.
So it didn't look particularly as period.
Yeah.
It was just a few drops and then that's it.
The only way, another way I would know, okay, this is, I'm on is my days. It would be spot on. Calendar, pop. On the day I'm supposed to start, that's when I notice, okay, my tissue is bloody, but nothing is dripping out. So, that continued. I'm excited. I can do my life. I can move on. I don't have to wear pads in high school. Like, that is such a relief, right?
As a lady, I mean, everyone's always looking forward to that period when you're not having your period.
Thank you. So fast forward, I go to campus. I was in a different land, different country, and the painful period began there. And now it was now going back to normal. Like now I'm bleeding as I should.
The normal average flow.
Exactly. Yeah. But I am experiencing cramps. But I mean, it's cramps. I mean, what's a biggie?
Normal for everybody, yeah.
Take your painkillers and move on. Yeah. What's a fuss? Are we going out tonight? Yeah. Let's move. Fast forward, I'm now an adult. I'm married. I'm working. And I'm in a season where there's so many people close to me who are passing away. And when I say close, it was like in like my...
Or just a minute. So when you started experiencing the normal period, it was just within the normal duration, like 4 days.
Yes.
Normal amount, pads back to normal changing.
Yes.
Okay.
Yeah. So, I mean, you're assuming, something has shifted. So now I'm back to normal. Yeah. So everything is...
perfect.
Wow. That's when the game is beginning, honey. Wow. So I've moved on. I'm married now. And I'm in a season where there's so much death happening around me, cancer, and there's just a lot. And I'm deeply involved in all these spaces. And I think we believe my body got to the point where it said, okay,
I've taken in too much.
I'm done. I'm done. I'm about to start exploding. You know how like when you're about to start your period, for many of us women, your face just, all the zits in the world decide, let us come and have a conference in your face.
Yeah.
I think for me, my body, it was the same thing. It just decided, you know what, I'm done, and I will now start showing you proper symptoms.
Wow.
So what took me to hospital without, like this one, it was to date, no symptoms. I will collapse and you will not know what you're treating, what you will start with. I remember we were about to bury my nephew. And because we got there earlier, at least we got to the mortuary earlier than everyone, my husband decides, okay, let's pop in at Nairobi Hospital because that's where he used to work. Let's pop in and just have my friends look at you, just so that we are safe, because you've been doing so much in a very short span of time. So we pop in and
a random checkup, just random.
Before the guests come, and they find my pressure is off the roof. And guys like,
this is not normal. Abnormal.
You're not showing
pressure.
any symptoms. You know, like, why? What's going on? So my husband then tells him, oh, you know, she's going through so much. So the guy recommends therapy. It's like, I'm not going to give you medicine. Let's try therapy. I want a report of every session you've gone through. This is the therapist number, not you giving me your therapist. I'm giving you the therapist. And I will have conversation with them. So I'm expecting 2 reports with every session. And we skipped and went to continue with our burial. Through therapy, then now some conversations come out, like, you guys have been married for long. Where are the children?
How many years in?
By then it was about 4.
Okay.
3, 4. Yeah. Where are the children? Do you guys find it weird that there are no kids? And that's a point you're like, okay.
Had you guys been intentionally trying?
Well, not quite. For us, it was, let's live, let's have fun.
Yeah.
If they come, well and good. If they don't come, then it's
No
also
biggie.
okay. Yeah, there's no biggie. Like, we're not together because of kids. Yeah. So it was.
Which I'm glad that you guys defined that early enough, because I know it's one of the biggest issues, infertility issues that many marriages come to an end just because there was no that conversation. And so when kids don't come, it's a deal breaker.
Perhaps before you settle and get married, please have all those conversations. Have them. Have awkward spaces
as a woman,
because
it's important.
Have all the conversations you need to. Even let him know that your period is 6 days, so that in those 6 days he's well prepared and he knows here I cannot disturb. Let me be nice, you know. Don't be afraid to have hard conversations. If someone is for you, then your hard spaces will not deter them from being with you. If anything, they will help you walk the journey. So please,
say louder. Yes.
Yeah, you guys need to have all those awkward conversations that you don't hear out there. Please have them. So I'm glad I'm in a space where we would talk about everything and anything, from money to you know, what if kids don't come? Are we here because of children? How many do you want? And so when we got into the space, it wasn't a new thing, because we'd already kind of dealt with it mentally, at least. I'm also grateful I have a very supportive husband. Oh, he's so supportive.
As a woman especially, and the things that we go through. You definitely, I mean, it's another word for any woman out there who is looking forward to get married. Just make sure, I think what you've said, Sheila, it's important to ensure that you get a supportive husband, because as women, the issues that we go through, whether reproductive, whether hormonal, but yes, it's important to have a very strong support system as you
Yeah.
journey through life and through the different health challenges that we could face as women.
And a lot of the times you find the issues we go through change as you change.
Yeah, absolutely.
They morph.
Yeah.
So me having little period to normal days and assuming now I'm okay, I'm normal, to heavy period in marriage. I mean,
we'll get there. We haven't even gotten there yet.
Like accept the fact that some of the things you're discussing might look little now, but there will be a heavy issue later because you will change, your body changes, things change, circumstances change, and probably because of even your environment your body responds to that.
That's true. Nutrition, a lot of things, a lot of conditions.
You get the first child easily, second child takes
a while.
Thank you. Your body changes. Things change. So have those conversations and just agree to stand by each other and not just for the female, because there are moments you will need to be there for this guy.
Absolutely. When
he's wondering what's going on with you, you will need a sane head to be able to explain, because for me, I'm blessed. My husband is a medic. So there are things I don't really have to go deep and explain. But for majority of the women out there who are experiencing things.
You have the responsibility of educating your partner.
Exactly. For them to understand this is what's going on, you have to take on the educator as much as you're the one going through the heart and the pain.
Absolutely.
So there's a lot of growing up to do.
All right, so we're the therapist.
Yes.
And then so the therapist asks you the question about children.
And it hits us like, we don't have mini-me's. And what's going on? What's going on? So we first forward end up at the gynecology. Okay, before we get to the obs-gyn, one certain Sunday, I'm serving Holy Communion. I am actively serving in church. That's who I am outside my home. So I'm serving Holy Communion, and after we are done, I go to the back of church, and all of a sudden I start having tremors. I'm just shaking. And it is not at your visitation of the Holy Spirit. I am shaking like crazy. And I'm not in pain. I'm just shivering, shaking, and it's not cold. It's hot. So one of my colleagues tells me, I just go home. Maybe you need to rest. I go to my HOD and I'm like, Mr. Pastor, I look at my hands, look at my body. I am in a zone. I need to go home. So he says, I won't allow you to go alone. Let me send someone to drop you off. So in the process of them dropping me, I call my husband and I'm like, hey, I'm in a fit. I'm just shaking. I don't understand why. I mean, I'm looking funny, like I'm just shaking. Everything about me is shaking. And so-and-so is dropping me home. We didn't live far from church. So he tells me, no, don't go home. Don't go home and sleep. You might sleep and not wake up. Turn, ask, let me talk to him. So he tells him, turn the car, take her to Warwick, because we're nearby. And then when you get there...
So that's the nearest hospital.
Yes, Nairobi Hospital, Warwick. And when you get there, call me and then let me talk to the doctor. Because, they're colleagues. So we get to Warwick and they try every test. Every test. My body is fine. But I am shaking. The doctor can see this girl is shaking. Every test they did, normal. So at some point, she discusses with my husband. I don't know what they discuss. And she comes back and tells me, now there's one more test. It is not in the list of what we should be doing because it is not, your symptoms are not for that test. But I just feel prompted to do this exam on you. And I want to do it myself. I don't want the nurses to do it. And then now we can move on from there. So she takes my blood sugar. And she finds it's up there.
Spiked.
And my symptoms are showing it should be. That's why they didn't have that suspicion. Like, let's check her blood sugar. And now that brings the issue of, are you diabetic? Why are your sugars this high? What's going on? And why are you exhibiting the opposite? Like, something is amiss. Your body is not behaving as it should. So when you get when they get suspicious that you're diabetic, they run you through a series of tests that can last like even 5-6 days. So I was taken through a battery of those tests, and once the final test is done, then they say, okay, for sure, you're diabetic, or you're pre-diabetic, or you're not diabetic. So I was found diabetic, and I was referred to a specialist. So it was during that time, then they start asking, is it in your family? If it's not in your family, you're the only diabetic person in your family, then why are you diabetic then? What's going on? Your body doesn't look like at your obese. You know, you walk to work every day. You walk to work in the evening. By what we have been told how you eat, it doesn't look like you are a lover of sugar. You know, what's going on in your system? And that's when they decided to go further. I go to an obs-gyn, and then they find my ovaries are cystic. They have cysts in them, and that's when they concluded, okay, you're polycystic. You have PCOS. So that brings a whole new level of issues to deal with. Besides being polycystic, the doctor also found my left tube. There's a test called HSG. It's not funny. It's not a nice test, no. But they found my left fallopian tube was blocked. Through other tests, they also found at the end of your fallopian tubes, we have finger-like structures called fimbria that help collect the eggs from the ovaries, then into the fallopian tube. Then different issues. One is not attached to this, other one is not attached to. So they had to be treated as
separate.
Yes.
Separate entities.
Yes.
Wow.
Yes.
So was the diagnosis given all at once? So you're told you have PCOS, you have adenomyosis, and you have endometriosis. Okay. All right.
Everything was, because all the tests were done together, like in the same period. Because if we're finding this as an issue, then what else haven't we seen? So let's just do everything. And because now we are inside her system through either transvaginal scans or ultrasounds or because we're inside now, we are seeing things.
Yes.
Exactly.
Yes.
So I'm glad everything got to be seen in one space time, because then I had the liberty, or should I say the grace, to deal with everything at once. For me, I found that better than having, okay, you think one is done and now you're ready for babies, and then it's not happening. Why? Because now you have this. It's not happening. Why? Because now I'm glad everything came at once. So we were able to figure out, okay, how do we move from here to here? So yeah, that was my diagnosis.
So how was life after? So you've been given the diagnosis and you've been told, these are the issues. How was life after that? Did you first of all experience any severe symptoms? Did you continue experiencing severe symptoms? And, how were you able to manage some of the symptoms that you would face?
So the symptoms seem to magnify now after that. It's like, now we've seen you. Now show yourself properly.
Wow.
Because prior, there were no symptoms at all. Like even for the high blood pressure, nothing. No symptoms. No headache, no. I was just fine, laughing away my life and skipping to sunshine. I think for me, what was the biggest space was that mental shift from I'm normal to
something is off in my
you're
body.
not okay, and we need to figure out what to do to get you okay. It gets to a weird space when you're listening about your diagnosis and what you're going through inside of you, things that you cannot see. You're being told by someone else about yourself, and you didn't have symptoms like that. So when they're saying how big a deal they are, you're like, but how? And then like for PCOS, you're told there's no cure because it's syndrome.
That's
A syndrome is not a disease.
Ovary syndrome. Yeah, it's just a syndrome.
A
It's more
syndrome-
management.
Thank you. A syndrome is many small things that are contributing towards this. This table has so many parts of it that have made it the table. It's similar to PCOS. There's so many small things that contribute to make this thing a big deal. So there's no one route of treatment. It's let's manage your hormones. Let's manage, okay, which hormones are we even managing? Let's take care of your estrogen. Let's take care of your progesterone. Let's take, so many small beats. Let's take care of your mental health.
So it's multiple ways of managing.
Yes.
And it's more so managing, not even particularly treating.
Yes. There's no treatment. No one knows where it starts from. So there's no even genesis. This is, you can't say I inherited it from my mother.
Yeah, I think that's the sad reality about some of the reproductive health conditions that a lot of women face, because you go to the doctor hoping that you'll get a one-time treatment, pill or medicine or something that would end the issues or challenges you're facing. But unfortunately, for a lot of women, the saddest bit, which ends up being bringing in a lot of mental turmoil, because realizing that I have to live with this for the rest of my life and there's no particular treatment or end to it. I think that's usually one of the biggest burden that a lot of women have to carry on their back.
And it makes things even heavier when it is not a commonly talked about issue.
Yeah,
It
when
is
it's
not a
spoken in harsh
commonly
tones.
seen. It's even those harsh tones. By the time I was getting there,
Yeah.
even those harsh tones weren't there.
That's true. That's true. I feel like right now in today's culture and society, that's when we've started being vocal and open about issues in regards to menstrual health or, just reproductive health. But prior, like back in the day, those were issues that
Hush.
you wouldn't even want anyone to know that I've faced or I'm going through such a challenge in my body.
Exactly. So just that space of you moving from this is what's going on now, and we need to figure out how to be okay.
Yeah.
We need to live. Actually, for me, my greatest desire was I need to live, and not just live, but enjoy my life. That was my motivation. Regardless of the space I'm in, regardless of what the doctors are telling me, regardless of the woye, I need to live, because Trisha's life goes on.
Yeah.
I'll see her laughing there and having fun, and then I'll sit
You'll
and
be
sulk.
miserable.
No thanks. I also want to live my life and enjoy. So for me, that was my main drive. Like, life has to go on. I must continue being the productive human being I have always been. This won't stop me because now I'm symptomatic, or now I have excess pain, or now. So I thank God for my doctors, because they have been quite supportive in not allowing funny spaces. It's get up and go. I remember when I was having surgery to correct my fimbria, so that they detach them from the small intestines and see if they can separate them. I checked into hospital today, had the surgery the
And that
next
was
day.
to manage the adenomyosis?
Yes,
Okay.
yes. And also give the fimbria life, so that they can try and do what they're supposed to do. I checked into hospital today, tomorrow, I had the surgery. And the next day, my doctor is like, what are you doing in bed? Get out.
Was it an open surgery?
Laparoscopy.
Okay.
Get out. Move. Because I want you home the next day. Like, there's no time to play, oh, I'm in pain, help me. There's no time for pity stories.
Yeah.
It's just, let's go. And that's why I say this is a wonderful story, because, hey, I'm here. I'm not sulking somewhere, drinking dawa because, well, someone suggested it might work, you know?
Yeah.
So I think during that time, the biggest thing for me was we need to move. We need to get up. No one will do this for me. I need to continue being a wife. I need to continue playing the role I'm supposed to play in this marriage, in my family, in society. And as a woman, you're a pillar. FYI. Baby girl and all. You're a pillar of the home. So that pillar crumbles and then, So I just had to figure out, have a kamkumji itself.
Yeah.
Let us move.
Okay. So for you, it didn't really heavily affect your quality of life.
Oh, no.
Or even just mentally, because I know there are women who, ideally, they even have to go for therapy. I think you did your own therapy, in terms of
let's talk.
just calling yourself for a meeting and telling yourself, okay, so this is the reality, but it doesn't take away from me living my life to the fullest, because I think a lot of women are crippled by some of the diagnoses that they get from the doctor, and the fact that there's no treatment to this, so it's more, we'll just manage, but then it's like almost like a death sentence. It's one of the things that you have to live with for the rest of your life. And so the mental processing of the realities, of these are my conditions, and then how am I supposed to show up in life fully? Well, I'm here struggling in pain, or there are days my hormones are just flared and they're all over the place, or there are moments when my bleeding is excessive, and I have accidents when I'm with people. So I think the mental turmoil for a lot of people, sometimes they may need to actually just go see a therapist to help them unpack some of those realities. But I think it's beautiful that for you, your quality of life wasn't heavily affected.
Because I didn't allow it. I didn't allow it.
Yeah.
By the time you're going to a therapist, you've allowed yourself into that. No one has pushed you there, by the way.
Yeah, that's true.
You've allowed yourself.
Yeah.
So I think even as a society, we need to push for self-strength.
Yeah. Like,
no one will do this for you. Love yourself extra. Look at yourself and say, no, imagine you no. You need to do something about A, B, C, D, and prepare yourself.
Yeah.
Let me give an example. Your period comes on this day every month. Okay? Why wait until that day to realize I have cramps, I'm moody, I yell at everyone. How about prepare yourself? Okay, so this and this is coming. Can I make myself a care pack for me? So when that time comes, I know these are the tablets I will take for pain. If I get moody, this is the music I'm going to listen to. If I feel like yelling at someone, I choose to smile at them before I yell. Like, prepare yourself. Do the active preparation. Don't sit and wait for that thing to come. And then now you start battling it when you're there. It will be double the heaviness. Because now you'll think no one cares. No one can see I'm in this space. My husband is not even caring. He's not even doing anything for me. No, prepare that space in advance. Make your own charge. Make your own care pack and let it be known.
Take charge of your whole life.
Don't touch this, because in 2 weeks, I will need this. No one should come to this box.
Yeah, that's true.
Yeah.
That's true. I think it's part of taking charge of your life, but I think it's also fair to also allow the spaces if you need the mental health support. If you need to go for therapy, because I think that was going to be my next question. I realize not every woman is privileged to have a strong supportive system. And I think for some of the conditions and challenges that we face as women, having a good social support system is part of,
It's
like the multiple
everything.
treatment that we've talked about. Having a good support system is part of the treatment, for
Yes.
some of the conditions that we have. And for women who don't have that support system,
Yo.
I think it's definitely an overwhelming journey.
Yo.
And that's what I'm saying. It will only be fair to allow women who are in those spaces to seek whatever professional help they need, even if it's therapy, and that was going to be my next question in terms of what support system have you been able to bring around you to help you in this journey of some of the challenges that you have gone through in regards to reproductive health, or maybe forums or platforms that you've been able to plug in, whether it's for PCOS or some of the challenges you've had.
I agree 110%. Just because I look well put together and thought through my spaces doesn't mean I don't get my moments.
Yeah.
But again, this is a part I want to really bring out. No one will get you out. That's what I'm just basically saying. Because even when you're saying therapist, who goes to the therapist?
It's yourself.
Thank you.
Yeah.
Who seeks that help?
It's you.
Exactly. Like no one will get you out of, no one will cause your feet to move to that next step. We have to strengthen ourselves. We need to get to that space where we say, even if there's no support system, because it won't be there for everyone, I need to do something for me. I need to get up and do something. Yes, I'm in pain. Yes, I'm depressed, but I can't sleep. It will kill me. I will die. And if that's what you want, Aki, because Trisha won't come and get you out of your bed. You get? So my biggest challenge is woman arise. In whatever state, whatever pain, whatever level of depression, get out. Just walk. Hata kama ni kutoka from your house and say, today I'm going to experience sunlight.
Yeah.
Just open that door and experience that sunlight for 10 minutes, then go back. It will do something. It will, and you will desire more of that sunlight, and you will find yourself the next day doing 20 minutes because you took that first step. If we continue pulling our ye card, Aki, life goes on.
Yeah.
No one will say, oh, well, yeah, guys.
Yeah, the world won't stop for you.
Your job will be given to someone else. Yet you still need to provide for your family. The things will move. Life will continue. That therapist will get another.
Part.
Yes, that therapist will get another client.
That's the hardest reality. Yeah.
So for me, it's beyond even the social circles, which again, you have to go out and seek them. Find your tribe. No one will come and say, Trish, okay, so you like maroon. I know 3 people who like maroon. You want to meet them? You will be somewhere and you'll notice, hey, those women there are speaking my language. Let me go listen. So even in the social circles, it's you to find your tribe. That's why you hear people saying, find your tribe. However it takes, whether it's online, whether it's, because there are people who don't want to be seen. There are people who don't want to be seen. They don't want to be heard. They just want, hata kama ni silently, but I'm part of this group.
Yeah.
You still have to be the one to find them. They won't find you.
Yeah.
So for me, it's first of all, research. Get out there and just research. Go online. Google your symptoms. Google groups near me. Google this near me.
Yeah.
You find even in your visits to the medic, to the doctor, they know people who are in spaces that can help you. Ask questions. When you go for your whatever checkup, ask the doctor, do you know anyone I can walk with through this? Is there any other patient of yours who's going through this? And are they in a, like, put yourself out, ask questions, because that's the only way you will get your answers. So for me, it's just, please be proactive.
Yeah.
We need you.
Yeah.
Gosh, we need you so much. If you wither and die, and then who will help Sheila? It's not a man, because that man is not going through what we are going through. And your flavor in this space is very different from mine.
Yeah.
Very, very different.
Yeah.
So for me, know your God. Know your spiritual space. Then know yourself in that spiritual space. For me, I got closer to God when I was at my worst. There was a point after fertility treatment, because we then began a lot of fertility treatment.
Yeah, and I was going to ask that, because we wouldn't do justice if you don't talk about the infertility challenges. And before you just get to the point that you were going to share, I wanted to ask you, at what point did some of the complications or challenges after the diagnosis, how did we get to the place of now having those infertility discussions?
Well, those begin at the diagnosis.
Okay.
Because that's the reason why you don't have children.
Okay.
So those begin.
Your diagnosis wasn't just for, you have adenomyosis, you have this, you have this. So you are told whatever you're going through is the reason why.
This is contributing to your space right now. So you see, that's what I was saying. I'm so glad everything. We didn't deal just with my body. We dealt with some whys, we dealt with hows, we dealt with my mind, just by being told,
this is it.
This
is the myriad of issues. Now deal with it.
This
all
one
at
is
once.
one we need to do. This one we need. This one we can't bother with. We can't do anything. It's a waste of time. This one we need to. This one. This one you will take drugs for the rest of your life. This one.
Because I think now for women who are not married, majority of the time you'll be told, so because of your diagnosis, definitely in the future you might face, challenges with bearing children and all that. But now for your case, you are already married and you're already experiencing the challenges. So now it was just more of a confirmation. This is the reason why you're experiencing the infertility.
Yes.
Okay.
And just because you're not married doesn't mean you wait for marriage to start seeing an obs-gyn.
Yeah.
Because now that's when you're having active sex with your husband.
That's the other area that women, it's part of taking charge of your life and your health, just advocate.
As they begin their periods, start having
proactive conversations with them. Are they having normal periods? Or the other day I was having a session with some young girls that I do mentorship for, and I was, just talking to them about, just menstrual health and just menstrual hygiene, and just telling them what's normal, what's abnormal. And I realized one of the girls in my group actually has abnormal menses, and I don't even think the mom is aware, because I told her, with your condition and from what you've shared, you actually need to go and see a gyna. She's 12 years, but then I had to mention that it's something that she needs medical attention for.
Yeah. So by the time she's 20, she's well aware about her body.
Yeah.
She knows I cannot get myself into such a situation, because this is what stress does to me.
Yeah.
This is what this does to my body. So I'd rather take care of myself. And what you will have is happier women.
That's true.
You'll have more smiley faces as you walk along the street, because you're in a good space. We hold nations.
Yeah.
And if we are miserable, then everyone else will be miserable.
That's true.
Yeah. So don't wait for marriage because now Mr. is here. Let us now go see a doctor. No. In fact, some even go when now year one, no baby. That's when they decide, let me go. And they don't even go together.
It's a lady.
Let me go.
Yeah.
Then now she comes back with issues and she doesn't even know how to present them. Thanks. So start your journey to the obs-gyn
together. If you're married, go together before you get married. Whoever you end up with,
even when you're dating, tell them, by the way, I have an appointment with my obs-gyn. Are you taking me? So that when you get married, you're not having awkward conversations about him sitting with you in the obs-gyn office, because many men do not like
you feel
that
awkward.
space.
Yeah,
Exactly.
yeah.
So have this moment, start seeing your obs-gyn, dear lady, as early as
Possible.
for mothers. Have the conversations, go with them to the doctor, and let them also get used to this test.
It's normal.
Exactly. In fact, you have just
Nailed it.
It is normal.
It's normal.
The only thing that's not normal is pain. Don't normalize pain. Pain is not normal.
Yes.
Yeah.
Yes. And you were mentioning something about the fertility.
Yes. So during the fertility treatments, we did quite a number. I did IUIs, which is intrauterine insemination. In layman's terms, for those of us who did biology and you were taught about artificial insemination, now change your perspective from the cow to a human being.
Now your husband.
No, to me.
Oh, now
I am the female cow.
You're the one being.
I'm the one who's being inserted, all these things. So just, change your perspective, now put it into the human form. That's what IUI basically is. I have done IVF, which is in vitro fertilization, where the egg and the sperm meet in a lab after harvesting, and then hopefully the conditions allow them to grow, and then they're put back into, once they become an embryo, they're put back into the female's uterus, and hopefully they attach and a baby is formed. So I've gone through all those. Major losses. I lost, at some point I lost all the embryos we had, and my embryos used to really behave like they would grow so well. They would bond with the sperm. They would do so well, and then after like 3 days after the fertilization, they die. And that also happened inside of me. There was a point where we had after we had transferred them back in, and they had started growing for 2 weeks, and then they died. They basically stopped growing, and they were shed off with my next period. So that space, even after all that loss, I still can't afford. I still can't afford to sit and sulk and allow life to pass. Yes, I had my moments. And for me, that is when I got deep with God. I got to get to meet a side of God I didn't know. That is where my music ministry was born. A full album just downloaded from heaven regarding the conversations I was having with God at that time. So yes, you will have those moments. But no one is coming to save you. You have to figure out, how am I getting? If that figuring out means calling Trisha and yelling,
venting, letting it out.
Help! Do it. But whatever move, the first move will always come from you. Yeah. Redemption is watching, it's waiting for you.
Yeah. And you also became one of the advocate for women's health and fertility and infertility conversations, and you're also part of the foundation.
Yes.
You can just mention or share about that and how you got into that space.
Yeah, so out of just me saying something has to give, we have to make noise.
Yeah.
Because I'm not hearing anything about this issue. I'm not seeing, and I'm sure I'm not the only one going through this. Something has to give. I'm blessed that my nature gets to be very advocative. If I believe in something, I will push for that thing until I see the fruits of it.
Yeah.
So that has also put me in that space of advocacy where I'll just tell you as it is. This is the space PCOS looks like. This is what we are going through, and we need to champion for these things. Out of that, I think I was seen on an interview, I think with This Is Esther Mundia. I'm not too sure if it was her interview or with Tina and Danko. I'm not too sure which of the 2 interviews, because those were the first 2 interviews I did, that the founder of Waiting Wombs Trust got to hear about me, and she's like, where? Okay. So we end up meeting, and oh my gosh, we are speaking the same language. And that is how I found myself in Waiting Wombs Trust. It's a book, a page on Facebook. It's a social support group where we just laid bare, this is what I'm going through, this is how it looks like for me, this is how it feels. But then again, it is you who will bring yourself. We won't come knocking your door looking for you. So come.
And it's
get
a
out.
space for women who
women and now men.
And now men as well. Yeah, because
Infertility.
I think we always leave men by the sidelines.
Yes.
But it's a space where any woman who's battling
anything infertility,
woman or man,
anything infertility, whether primary fertility or secondary infertility. Secondary infertility is where you have had your first child and second child, and now you want another child, and it's taking scientifically long for that to happen, probably because of changes in your system, changes in your body, changes in your environment. People assume because number 1 came, number 2 should come, number 3 should come, number 4 should come, and we close the chapter. For some people, 1 will come very easily, number 2 becomes a struggle. We also have those. So it's just basically an open group for anyone who's experiencing infertility, and would just like a space where women and couples are just being and saying, this is what we're going through. I'm annoyed today, but this is me today. And we just help each other.
Great. So as we learn this conversation, I wanted to know what are some of the lifestyle changes that you've had to incorporate in your life to manage some of the conditions. It could be from nutrition to, supplements to exercising. I don't know what specific course of treatment that you've incorporated into your life that has been beneficial that you can share.
So majority of people who experience PCOS will be told to lose weight. That is what many doctors say. By the way, PCOS has been there since time immemorial, but it is such a new phenomenon, even in the medical industry, because you're treating so many, you're trying to manage so many symptoms. So even for many medics, they cannot really touch and say, do this, do this, do this. So there's a cold war between the patients and doctors. So please go to someone who understands and is specialized in what you're going through. There are some, just because they're an OBGYN doesn't mean they know how to take care of PCOS. An OBGYN will probably take care more of your pregnancies and your period. But we have fertility specialists who are a tad bit deeper than OBGYNs, and they can handle PCOS, they can handle this, they can handle that. So they won't give you blanket
treatment options. Yes.
And prescriptions.
And prescriptions, yes.
Because you will have a 12-year-old who's experiencing early symptoms of PCOS, and they're being given
pill, contraceptive.
Like really?
Yeah.
Like really, what are you doing to this girl?
Yeah. It's not a quick fix. Here's medication, we are now sorted.
Don't forget those pills have major side effects.
Yes.
Kidogo, she has ballooned and added so much weight, and her ego finished. Her self view finished. Go to the right people. Find out who knows what you need sorted for, so that you're not just...
If possible, get a specialized doctor with experience.
Exactly. So I at first had a nutritionist assigned to me by the endocrinologist, the doctor who was treating the diabetes and hypertension. I got a nutritionist assigned to me. I got my meds. I got all that. And with that also comes with Well, not necessarily exercise as we know it. Because when you tell someone exercise, they just think gym.
Yeah.
Not everyone can afford a gym.
Yeah.
But please just keep a healthy
lifestyle. Whether it's walking.
In fact, walk.
Yeah. Walk is one of the
Don't even,
simplest
let's not even
exercise.
go beyond anything. Just
walk. It's good enough. It will do wonders.
And walking just doesn't do it for your body alone, even your mind.
Yeah.
You get to hear the birds. You get to see
nature
things. You get to see people. I'm a people watcher. I just love watching people and laughing and going like, "Any God, you created this human being like this." For me, those are the conversations I have even as I'm walking. So I walk a lot. I eat. I don't eat to be full. I eat enough to just get me to the next meal, so that I'm not stuffing myself. I listen to my body. I won't get myself into a space where I'm overindulging. I have learned to say no. I have learned to say no. I won't have that. Just give me water, or no, I need sugar now. Otherwise, I'm going to go down. So I've learned how to listen to my body, how to read my body, how to know what my body wants and needs, and take care of it as such. Okay. So listen to yourself. Unlearn habits that we have grown up with, that ugali is it, that, if I don't eat this, then I will not live. Unlearn those those habits, and now relearn. What do I need now? What do I need now? What does my mind need? Is this space good enough for me? If it's not, then no, I will not come. There are interviews I have said no to, because I know by the time that interview will be over, I will be so mad because of the other guests who will be there. I know the kind of people they are. So this is not good space for me. I choose out. So it's just basically minding your space.
All right, great. What a way to land this conversation. Thank you so much, Sheila.
I'm so excited.
That was amazing. And I believe that a lot of women have gleaned, just from your story on how to manage and carry themselves despite the symptoms or challenges or conditions that they may be facing. So thank you very much.
You're welcome.
Yes, and to our viewers, thank you very much for tuning in to today's story from Sheila. I believe that there's something that you have taken out from today's conversation, and most of all, remember that you are your own greatest advocate. So listen to your body, ensure that whatever condition or challenge you're facing, ensure that you get a specialized doctor who's able to walk you through and to be able to get the right treatment course for whatever condition or challenge that you are facing. And remember, we have support groups that you can be able to plug in and join, where you can get to speak more about some of the things you're facing and be able to get the right support that you need. But that's it for today's conversation. Remember to subscribe to this channel if you haven't, and share this episode with your girlfriends, with women around you, so that they too can get to be educated. But that's it. Until next time, it is a goodbye.
Bye.